move on to hip replacements now, because that's something that really seems to me to be so intricate, and people look at it from an athletic standpoint. So here we go. With regard to hip replacement, let's take this. The risks of problems after surgery are much lower than they used to be. That's a key. People can spend 1 to 4 days in hospital, but it usually takes 3 to 6 months to be completely well after something like a hip procedure. So Dr. Van der Ven is going to tell us what happens in a total hip replacement procedure. Doctor, go ahead and give us an idea here what we're looking at.
Thank you, Ed. And I also want to emphasize that hip replacements probably will reach a higher potential than knee replacements. And although it sounds like a very invasive type of procedure, we are actually seeing people realizing their potential even more with the hip replacements. But again, with hip arthritis, the deterioration or loss of the cartilage between the femoral head and the acetabulum. So you have this is the replacement, but here, natively, you would have a ball, and then you would have the socket of the native pelvis. This is the pelvis bone that connects to the spine. Here's one femur bone. The other femur bone has been masked by this image. With arthritis, you get a grinding sensation, a loss of separation between the two bones. Sometimes the hip will become stiff, obviously very painful. It leads to a limp. It leads to loss of flexibility. Very often patients can't get to their shoes, can't put on socks, and most importantly, they develop chronic pain. With the surgery, and all hip replacements follow the same similar system where the head of the femur bone will be removed, a metal prosthesis will be placed into the top of the femur bone, and similarly in the socket, we'll remove the lining of the cartilage and replace a metal shell with a piece of plastic typically. The surgery itself, in most cases, will take less than an hour, and very often, patients can be up walking the same day and can be off a walker or any assisted device sometimes even within a week, sometimes even less, sometimes even just a few days. But as Ed said, full recovery before you're returning to almost all your activities can take sometimes up to 6 months.